Hi, Dr. Steve Geary with Stebbin Hawkins Clinic of the Carolinas. Really, we're talking about kneecap instability or patella instability today. And with any joint, when we say instability, we mean it goes past normal. So we have some inherent flexibility or motion in our joints, and if it goes past the normal point, we call that instability, and that can be a partial coming out of joint, which we call subluxation, or completely coming out of joint is a dislocation. And so specifically in the knee, in the patella, this can be, majority of the time, this is something that can go out to the side if it goes past point, if you will. Meaning normally it has some inherent balance on both sides of both the muscles in the quads above and the tendons around the kneecap. However, if the patella, quote, slips out of place, that's something that usually happens to the outside, and it can be a spectrum from a partial or subluxation or a complete dislocation of the kneecap. When that happens, there can be blood in the knee, pain, stiff, swollen. About 10 to 15% of the time we can chip off a little fragment from under the kneecap, and that which we call a loose body, and that can be a bony cartilage fragment. If that exists and it's big enough, then sometimes we have to remove that. The initial treatment is usually trying to calm down the knee, so reduce the swelling, restore the motion, and getting the quads muscles firing again. Usually that involves some type of bracing, either and possibly even some immobilization, but usually into a patella brace, which creates some force on the outside part of the kneecap to kind of keep it at home or vector that way, but still allowing motion to be restored and then quad strengthening to be restored. So that's kind of a sequential program of bracing, progressing activity to some quad strengthening, and then ultimately getting folks back to more exertional force, first linear, and then some change in direction activity, and then ultimately sport-specific cutting, pivoting activity. The majority of times with a first-time or initial dislocation of the patella, we are engaging in that conservative treatment. Even though there is some soft tissue injury about the knee when that happens, for the kneecap to go out to the outside part of the knee or laterally, like in this right knee, there has to be some injury to soft tissue on the other side. And so even though we rehab this, if it becomes a recurrent dislocating kneecap, then sometimes we are engaging in surgical treatment to tighten things up on the injured side and sometimes loosening on the other side. Subsequently, the people are back in a similar kind of rehab approach where we're progressing their motion, their strength, and then ultimately their physical activity, and usually with some temporary bracing in transition. Thank you.